Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. For a cook, the greatest reward is someone appreciating his or her food. I received this message from an unknown lady on social media, and it goes like, I can't thank Dr. Apoorva and you for having created this podcast on endometriosis. I have been suffering for the last 3 years, and I do consider myself fairly updated on the disease. But it has taken me countless hours of searching the net and trying to wade through an ocean of information. A lot of it, which I realized later, was not entirely correct. In 2 podcasts, what the two of you have put together is more than what I have ever heard, read, or been told in the last 3 years. God bless you both. Wow, that's something. A huge thank you to this lady and to all of you for appreciating our work and for believing in us. So here we are, Dr. Apoorva and myself, with the 3rd edition on endometriosis, and this time it's endometriosis and fertility. Dr. Apoorva Pallam Reddy is a gynecologist, IVF specialist, laparoscopic surgeon, and aesthetic gynecologist from Bangalore. At a very young age, she has achieved the knowledge and expertise that's enviable. We work together on many projects, including hosting a series called What Women Want on Instagram, as well as an academy for training young gynecologists in infertility called International Fertility Academy. An oration at any conference is like the coveted guest lecture, which is given by someone very, very senior and is usually, in the main hall of the conference where every delegate, Indian or foreign, is listening. You can almost compare it to a Lifetime Achievement Award. I'm proud to say that Dr. Apoorva is the youngest fertility expert in the country to have delivered this oration at a national conference, and that too 2 years ago. So congratulations, Dr. Apoorva, and thank you for being on the show.
Thank you so much, Dr. Rajeev. It's always a pleasure to be here with you recording these podcasts. As I said, there is so much of information that I also learn from these podcasts. It's only natural that all our listeners are in love with the information that we are sharing with them. And you do know that I seek a lot of inspiration from you, and a lot of what we have achieved together is because you have relentlessly pushed us to do this. And, no matter how hard it is, believe me, for someone who is so busy with all their work, to make sure that we continue giving this information and placing these podcasts, it's only because of your passion towards the care and the right care you provide for your clients. So always happy to be a part of these podcasts.
Thank you, Apoorva. And let's go back to our question answers. So
Absolutely.
My first question to you, how does endometriosis cause infertility?
Now, this can happen of multiple reasons. So I keep telling that for a couple to get pregnant, from the wife side, we need a good uterus, tubes, and ovaries. So since the uterus, tubes, and ovary may be stuck to each other, to various organs and the structures around them, the anatomical relationship between the tube and the ovary may be lost. Let me explain a little more simply. The job of the fallopian tube is simply to pick up the egg from the ovary, but that is only possible if the end of the tube is sweeping over the surface of the ovary. So if this relationship is lost, then the egg does not enter the fallopian tube and thus cannot meet or fertilize the sperm. The active endometriotic tissues release certain chemical that sort of eats up or destroys the sperms or egg, or sometimes both of them, that are forming the embryo. Lastly, the walls of the uterus can be invaded by adenomyosis, and this prevents the embryo from attaching to the walls, which is a necessary event for us to get pregnant. So to put it in a simple nutshell, all the factors that are required for pregnancy for a woman are affected one way or the other because of endometriosis, and thus women who have endometriosis have a slightly lower fertility as compared to the women who don't. As we said before, fertility treatment is an entirely different ball game altogether. How should a woman with this issue plan forward, Dr. Rajeev?
So, fertility with endometriosis needs very serious consideration since it definitely decreases with this disease, as you said.
Sure.
Getting pregnant can be a problem for some women with endometriosis. Treatments which were effective for pain management, and we've discussed so many options in our last podcast, those don't work in infertility with endometriosis.
True.
Treatment mainly depends on the stage of the disease, and of course, some other factors like what is the age of the woman and what is the status of her ovarian reserve or how many eggs she has at that time, whether the fallopian tubes are open or blocked, or the male partner sperm parameter report. So how are the sperms doing? So all these factors put together will help us kind of decide what sort of treatment she's going to require. A very careful planning has to be done after initial evaluation and after considering all of the above factors. This is the most important stage. And we always believe that over-treatment is fine because ultimately, even if you over-treat, you do get a baby. But under-treatment is not, because if you under-treat, there is a good possibility that a lot of them who could have become pregnant will never become pregnant.
Absolutely, true that. In endometriosis, despite the insides of the tummy being in a really bad shape and sometimes the tissues and organs being stuck to each other, if the fallopian tubes are tested, more often than not, they are open. And this confuses not only the doctors but the patients also into thinking that natural conception can be tried. Natural conception is more likely in the early stage, that is in stage 1 of the disease. There are algorithms that can be used after staging the disease via laparoscopy. Now, these algorithms or formulas can tell us the probability of natural conception in 1 year following the staging laparoscopy. Problem is, stage 1 and 2 of the diseases cannot be discovered without a laparoscopy, thus even with symptoms, unless one is very alert about endometriosis, one can waste time and realize only when the disease is more advanced. However, while one waits, we must remember that this is a progressive disease and algorithms can guide but don't guarantee, and as the disease progresses further, fertility only keeps going down. So Dr. Rajeev, would you really recommend someone to try naturally if you discovered that they have early endometriosis?
That can only be decided, as you said, after considering other factors like age, sperm quality, etc. If all is normal, then maybe I would suggest to try for maybe maximum of 3 months, but under strict supervision. And if that doesn't work, I would suggest them to move to IUI immediately.
Right. The next level of treatment, as you said, is to go through an IUI, or that is intrauterine insemination. We won't dwell on the details of this treatment as it's worthy of a complete podcast by itself. But in a nutshell, the process involves creating a controlled environment wherein we give the women medications and sometimes even injections in order to make good quality and higher number of eggs. Monitor the growth of the follicles that contain these eggs so we know when is the right time to perform an IUI, wherein the man's semen sample is processed so as to remove the bad sperms and make the good sperms even better, and then finally placing these sperms into the uterus with the help of a small and a very thin catheter. It technically takes just about 2 minutes and it's completely painless procedure. Now, this treatment is possible only if the disease is in stage 1 or 2. If the disease is extensive, like in stage 3 or 4, IVF is probably going to be a better option and improve pregnancy rates.
I think this take-home people need to understand very, very carefully that only in stage 1 or stage 2 should IUI be done, and in more advanced diseases, one should move directly to an IVF. A lot of times, both you and I keep getting patients wherein they keep pushing, saying that, I've just started treatment. Why should I get into an IVF process right now?
Absolutely.
Not realizing that this is a progressive disease And
True.
with time, it's going to reduce all parameters, as you've said, all aspects of fertility, whether it's ovulation, whether it's implantation, whether it's fertilization, tend to get reduced with time. So the faster, the better.
Right.
So
I think
before,
more often than not, the kind of question that you and I get is, Doctor, can't we try an IUI in a stage 3 or 4? But I think the problem, what people need to understand is we can definitely do an IUI in stage 3 or 4, but the results are not going to be the same. Why are we doing the procedure? We are doing it to improve your pregnancy chances, to get you pregnant. But if we go ahead and do an IUI in a stage 3 or 4, the probability of you getting pregnant is going to be very, very negligible. What do you say, Dr. Rajeev?
true, very, very correct. So before progressing further, let's answer some rapid fire questions that I have received on social media. So, can I not get pregnant naturally?
Yes, you can, but you also run the risk of worsening the disease while you wait. My doctor has said to undergo a laparoscopy to remove the endometriotic cysts. I am trying to get pregnant. Is it advisable?
So, laparoscopy has a very specific role to play to make a diagnosis and for staging of endometriosis. 2. To remove large chocolate cysts when they are obstructing the IVF process or are more than 4 centimeters in size. Lastly, when the woman is in excessive pain throughout the month and laparoscopy is done to reduce the disease burden. Beyond this, there isn't so much of a role for laparoscopy, especially for a woman who's getting into, say, an IVF process. A few years ago, it was the trend to jump to surgery the moment one saw endometriotic cysts. But today we know that the treatment has its own pitfalls and thus recommended only in very specific conditions. So please discuss with your doctor the pros and cons of doing a laparoscopy before you jump into it. So should one have chocolate cysts removed or drained? So there are two ways for the listeners that the chocolate cyst can be treated. It is either removed completely or one can just put a needle into it and drain it while doing a laparoscopy. So my question, or rather the listener's question, is which one should be done? Apoorva?
When fertility is not the goal, removal of cysts is the right choice because the chances of recurrence of this cyst is lowered, though still a likelihood. However, when fertility is the goal, removal of the cyst may reduce the number of eggs or the ovarian reserve by almost 40 to 50% over the next 6 months, and this loss may not be recovered. Owing to this potential loss of eggs, draining of the cyst may be a better choice. Your doctor will be the right person to discuss with you and decide which is the right treatment for you, probably based on your AMH, that is, which gives us an understanding regarding how your ovarian reserve is. The idea of me saying this was just to make you more aware so that you can discuss with your doctor before jumping blindly into a procedure.
Absolutely. I don't think we can really comment as to which patient is going to require a cyst removal or should take a cyst removal and which patient should probably go into an aspiration. But this is a general guideline that we are giving everyone. But of course, case to case, you need to discuss with your own doctor as to the pros and cons of it.
Right. I think both of us have discussed regarding the role of medical therapy extensively in our previous podcast, specifically for pain. So does that work in fertility as well? Because we keep hearing that from patients that their doctors have recommended to take injections in order to stop the periods for a few months in order to manage the pain.
So there is very limited role of medical therapy when it comes to fertility management and endometriosis as compared to pain management, and we've spoken extensively on this in the last podcast.
Right.
The basis of medical management is stopping the periods for long periods of time so that the endometriotic tissues, which are estrogen hormone deprived and thus shrink in size. When periods are not happening, obviously ovulation can't occur, and thus if ovulation doesn't occur, how does one get pregnant? When the effect of the drug goes away, the periods return, but unfortunately, so does endometriosis. That is why medical management is looked down upon when treating patients with fertility issues. The only one role, and a very good one, is when we perform IVF. In IVF, we collect the eggs first, And since after that we don't need ovulation, we stop the periods for 3 months with medical management, causing shrinking of both endometriosis and adenomyosis, that is endometriosis in the uterus. Now, when the embryo is put back into the uterus after 3 months, pregnancy rates are much better than if the medical management wasn't used. So, coming now to the success, is the success rate of IVF in a woman with endometriosis the same as someone without endometriosis?
Unfortunately, no, because of the multiple factors like poor egg quality and damaged uterine walls. The success rates are lowered even in an IVF. We can't stress this enough because most people somehow feel that IVF is an end point, and once they do IVF they can get pregnant at any given stage. So that's really not true, specifically in the case of endometriosis. Now, how much lower the success rate will be because of the endometriosis will completely depend on the extent of damage. We have patients who come in having tried various treatment options over the year despite endometriosis, always thinking that IVF is the last option, and they will take that up only when all roads are closed. Little do they realize that when they finally take it up, we already have our backs against the wall. The result, of course, is multiple failures. Higher costs, frustration, misunderstandings as to why things are not working out despite IVF. And lastly, landing up with donor eggs or surrogacy. IVF is a fantastic treatment, but it can help only if you avail of it in the time. Don't let water run over your head before you reach for the life jacket. This is why guidelines have been laid down, and I reiterate, stage 1 and 2 IUI is a better choice, and for stage 3 and 4 IVF directly and immediately.
Wow, that's been quite a bit of discussion on endometriosis and fertility, and we're again coming towards the end of our podcast. We know it's been quite long, that's why we've had to break it down to 3 parts, and even this part is now approaching a long length. But a subject so vast, complex, and debilitating deserves all the attention and time we can give it. So to summarize here, some points and some take-home messages. Endometriosis is a progressive disease.
Sometimes it takes up to 8 years before a diagnosis can be made.
The symptoms do not correlate with the severity of the disease.
Endometriosis can cause infertility.
Fallopian tubes are usually open in endometriosis, giving a false sense of complacency that pregnancy can occur naturally.
Endometriosis is bound to recur after both medical and surgical management.
Treatment will depend on the age, the symptoms, and the need for fertility.
Speak to your doctor about future plans and the pitfalls of surgery before getting a laparoscopy done.
And it's a wrap. Thank you, Apoorva, for being here and giving so much of time. I'm sure we will be coming together with many more podcasts. IUI is waiting, IVF is waiting. I've been getting so many requests from people that we are not really talking about organized treatment per se, and I think we have to get into that now.
Absolutely. I think we just had to discuss the various medical conditions, that can affect women before we really got into what are the treatment options that are awaiting them. So yes, definitely IUI and IVF is going to be our next line of management for the podcast.
This brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as we enjoyed making it. Thank you for all your reviews and suggestions. You're making our work so much easier and better. If you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic of your choice. This podcast is available on Anchor, Headphones, Spotify, Breaker, Google Podcast, Overcast, Radio Public, as well as Apple Podcast. Do subscribe to any one of them or on Apple Podcast and leave your comments and suggestions. Looking forward to great interactions. Keep listening.